Documentary on Netflix has brought the conversation around the mental health effects of social media to the forefront. Cronkite News reporter Tyler Mannion went beyond the film to find out what the science is saying.
The physical struggles caused by the COVID-19 pandemic have been well documented around the country. But psychologists are saying the longest lasting pain from all this might be less visible.
On the mental health front of things, if we don't take care of business now, it's going to look far worse in the future. And this could be the longest lasting impact of COVID-19.
Before the pandemic, adolescents were surrounded by familiar faces in schools. But just like that, those familiar faces disappeared, and they were all alone in quarantine, with social media as their only form of positive or negative mental reinforcement.
So that primitive part of my brain, I'm not getting as much stimulation, and so that might make me feel less happy, more sad, more disconnected, more isolated, and lead to that kind of rise in feeling depressed.
The Social Dilemma is a popular new documentary on Netflix that explores this topic, specifically with a look into the rise in suicide for teen and preteen girls in the last decade.
The older teen girls, 15 to 19 years old, they're up 70% compared to the first decade of the century. The preteen girls, who have very low rates to begin with, they are up 151%. And that pattern points to social media.
Tao Ha, an assistant professor in the Department of Psychology at ASU, has been conducting research throughout the pandemic on youth mental health and relationships, and does not agree that society should claim social media has a direct negative effect.
From the most recent research, it actually shows that there is actually very low correlations, indicating that social media use is not necessarily related to mental health.
In a study currently under review, Ha and her team found that social media is actually helping young couples.
It's a way for them to connect. It's a way for them to feel part of a group with their friends. It's also a way to feel connected with their romantic partner who they might not be able to see because of COVID.
Although she's found data showing its benefits, the possible downfalls are apparent, and her scientific conclusion remains up in the air.
It's way too early to actually say that it's either good or it's either bad. And I think the conclusion eventually, years and years down the road with more research, is going to be very nuanced.
While the experts disagree on whether or not correlation can be claimed just yet, they all agree it's a conversation that needs to be had. In the studio, Tyler Mannion, Cronkite News.